On the website, there is a lot of data that shows information about the spread of COVID-19 throughout Utah. Some of this data shows how COVID-19 affects different populations and the communities we work with.
Did you know the coronavirus pandemic is disproportionately impacting communities of color?
In Utah, communities of color make up the majority of COVID-19 cases, even though we only represent 21.5% of our state's population.
People are having difficulty accessing resources.
And what's worse, the pandemic has amplified hate, stereotypes, and fear.
This must stop.
This must stop.
This must stop.
We need to stand together during times like this.
Let's amplify facts and unity over fear and division.
And do simple things like wearing a mask in public or staying home when sick.
To protect our most vulnerable.
I'm not a virus, I'm a person.
I'm a mother.
I'm a business owner, an architect, a brother, a son, and a partner.
I'm a father. I'm a husband. I'm a brother. I'm a son. I'm a doctor.
I am a daughter, a sister, a friend.
I'm a wife and mother. I'm a community leader.
If you are experiencing shortness of breath or difficulty breathing, fatigue, fever, sore throat, or loss of taste or smell,
please get tested for COVID-19 and self-isolate immediately.
Your health should come first.
Because you matter.
Because you matter.
Because you matter.
Visit coronavirus.utah.gov or your local health department's website for more information.
These numbers tell a story. They tell the story of why our jobs as community health workers are so important to help stop the spread of COVID-19. Racial and ethnic communities are affected at much higher rates than other populations in Utah. For example, Hispanics and Latinos make up about 14% of the total Utah population, but nearly 40% of all COVID-19 cases in Utah. Understanding this data can help guide our conversations so we are able to help people understand how serious the virus is. People may feel a lot of stigma and may not always be able to take the steps to keep their families safe. When we are able to use facts and data when we talk to people, we can help them really understand what to do, because we also understand them as a person.
Hola.
Assalamu alaikum.
Mabuhay at luwid kayo.
COVID-19 is on everyone's mind.
But it's impacting our multicultural communities especially hard.
Communities of color have been disproportionately affected with higher rates of COVID-19 in Utah.
Muchos de nosotros estamos al frente, siendo trabajadores esenciales.
Who may not have the benefits to protect themselves from this disease.
Some have lost their jobs.
Some have experienced discrimination or hateful words.
And some have unfortunately passed away or lost loved ones.
We can all do our part
so that we emerge stronger from this crisis together
and celebrate the diversity and resiliency of our communities.
So none of us are forgotten.
As restrictions are relaxed, we still need to be careful until a vaccine is developed.
We can all take steps to stop the spread of this disease by doing key things.
Regularly and thoroughly wash your hands with soap and water or clean them with an alcohol-based hand rub.
Avoid touching your eyes, nose, and mouth.
When in public, cover your nose and mouth properly.
Please keep the mask on. Pulling it down exposes you to the virus.
Stay 6 feet apart from others in public spaces.
That means no hugs or handshakes.
But we can show our unity by protecting our families and loved ones.
Our elderly.
Our essential workers.
Our most vulnerable.
Do it for your family.
Do it for our community.
Let's do this together to stop the spread of COVID-19.
And the spread of stigma and discrimination.
Because together, we are stronger.
Utah strong.
Somos un Utah fuerte.
Tu que malo Utah.
Utah tahayu to tapizil.